meeting. So just to give you a brief outline, for the next 3 months, July, August, September, Plantation Health Ministry will be pretty much hosting the Wednesday nights prayer meetings. And we're just gonna try to indulge in a little bit of health talk. For the month of July, we're pretty much gonna be based on our theme is Step Up to Wellness, Body, Mind, and Spirit. Mind, Body, and Spirit. Yeah. Okay, so our theme is Step Up to Wellness, Healing the Mind, Body, and Spirit. So for this month, for the month of July, we're going to pretty much look at the mind in terms of psychological, psychosocial. And then for the month of August, we're going to focus on the body. The food we eat are pretty much our physiological aspect of the body. And for the month of September, we're going to focus on the spiritual aspect and how that impacts. And we're just going to tie it all in. Hopefully at the end of September, we're hoping to have a health fair. We just culminate the whole thing. So just trusting in God that it's going to be a good quarter, and we'll all be able to learn some things and benefit from what we are hearing. We are going to try to make this as interactive and as interesting as possible. We are privileged tonight to have with us Dr. Stephen Campbell. He is a clinical psychologist and professor at Nova Southeast, and he's going to speak into us tonight, and pretty much the psychological aspect and how it impacts with our spirituality. So, without any further ado, we're going to invite Dr. Campbell to speak with us.
Oh, you were recording? Okay. It's my privilege to be here this evening to talk with you about mental health. I need to ask you a big favor, and that's you'll come a little closer so we can interact. Even though it's recording, I still want to have you close to me so we can talk. Oh, you're streaming live? Oh, okay, my goodness. That's a lot better. Thank you so much. This evening, I was asked to speak on the topic of mental health. And many times, people talk about mental health. What does that mean? What is mental health? Can anybody want to tell me? State of mind? Anyone else? How healthy is the mind? Okay. Those are certainly good definitions. Absence of disease. Oh, that's a big one. The process of thinking. Well, simply, mental health is what we think, how we feel, how we behave, how we interact with each other. That's a simple definition of mental health. But as you can see, the thinking process involves a lot of different things. If you look at mental health from the perspective of the diagnostic manual that we use for diagnosing people, you have to look at disorders before you can determine what type of illness the person has. But sometimes we forget that mental health does not always mean persistent mental illness. For instance, all of us experience anxiety, depression, fears, and that's normal. It only becomes a problem when it impacts your ability to function. So to say if you have anxiety, that means you have a mental illness, is not always accurate. It depends on the level of anxiety and how it's impacting you. If you're experiencing a period of depression, it does not mean that you have a mental illness unless it is preventing you from functioning. You cannot get up from the bed, you cannot go to work, you have no appetite, you're losing sleep, you're not talking to your friends. That's a different story. Fears. Some people are afraid to fly. Some people are afraid to drive on the highway. Some people are afraid of mosquitoes. It doesn't mean because you have these fears mean that you have a mental illness unless it becomes debilitating. So it's important to keep in mind that there's a big difference with psychological issues that we all deal with on a daily basis and someone who has a persistent mental illness that's impacting them. So tonight, maybe we're going to get a chance to interact looking at the two different aspects. The one that may be biological in nature, or the one that you might have learned because of the interaction you have with people, or because of some experiences that you have had, environmental issues or whatever, it is impacting you so that you're not functioning very well. Are we okay with that? Okay, so get your questions ready. I think this is going to be very interactive, okay? I must talk about what's happening in the media. The media has a way of making people's mental illness look bad. By that I mean, anytime a crime is committed, the first thing that people say, the person is mentally ill. That is not necessarily true. Not because a person commits something or did something that you feel you would not do and is out of the norm, doesn't mean that the person is necessarily mentally ill. And I think that is something that we need to pay attention to, because every time a person commits a crime or they behave in such a way that we feel is not normal to us, we're quick to say that a person is mentally ill. But I strongly believe there's a difference between mental illness and someone who's just evil. Do you get that? Okay? And sometimes the media does not want to use those terms because that become more spiritual in nature. But there are evil forces out there. And it does impact people's behavior. So most people with mental illness are not violent. Let us settle that matter. That's a myth. Most of the crimes that are committed in America are not committed by mentally ill people. Even the ones that we consider really off the chart, like Parkland. Now, yes, this person has some psychological problems. Growing up, and many different things might have happened. But it doesn't mean that people who have had bad parenting or had problems with their home are going to go and kill people. Maybe some of us here might have had bad parenting, but we turn out okay. So don't assume because a person was exposed to some sort of trauma mean that they're going to go out and kill people. These are rare and few and far between. Mental illness is universal. By that I mean anywhere you go in the world and you talk to people about mental illness, the symptoms are the same. I've traveled many countries, and schizophrenia is schizophrenia in Africa, in China, in the Caribbean. It's everywhere the same symptoms. The person have delusions, they have hallucinations, and they're paranoid or whatever. So if that's true, why it is in so many other countries we do not have the kind of crimes that are committed here? Something to think about. A lot of our psychological problems can be environmental. It can be environmental. It can be learned because of the values and beliefs of the culture and the society we live in. So we're looking at two things now. We're looking at parenting, upbringing, environmental. Now we're looking at lifestyle. Lifestyle. Now, we have to keep in mind that there's some serious mental illness that does have a biological basis. For instance, schizophrenia, which is the number one on the chart from the most severe to the least. Schizophrenia is on the top of the chart. And we know for sure that there's a biological basis for schizophrenia. Why? You can talk to a person with schizophrenia until the cows come home and the behavior will never change. They'll still have hallucinations and delusions and so on. Why? Because it's a disease of the brain. The neurotransmitters in the brain is giving wrong signals. And unless that person is taking medication, it does not change. So we know that some mental problems, there is a biological basis. As a matter of fact, there's also a genetic component. That if two parents are diagnosed with schizophrenia, there's a very high probability that children will end up with schizophrenia as well. But in terms of the lesser issues that we deal with, like anxiety and depression and fears and low self-esteem and all those things that we talk about, we can fix those. We can fix those. We can certainly help the person overcome those things because it doesn't always necessarily require medication and so on to fix those. Schizophrenia, bipolar depression, and other types of diseases that are biologically based, you need medication to help control those most of the time. So now that I've set the tone for what is considered persistent mental illness and serious, and the ones that are learned, and the ones that all of us cope with every day, hopefully you're going to have some questions for me regarding why you're here this evening. Now, stress is a very, very important part of the formula. And stress has a medical component, which I'm sure you'll be talking about at some point, but there's also a psychological component when we look at stress. I want to give you a quick little screening test just to see how many of you are stressed tonight. Is that okay? Okay. So you can answer these questions in your own mind, and then you will tell me what you think. Here we go. Are you usually casual about appointments or you're never late? Okay, think of that. Are you casual about appointments or you're never late? Number 2, not competitive, very competitive. Never feels rushed, even under pressure, always rushed. Take things one at a time. Tries to do many things at once. Slow doing things, fast doing things. For instance, walking, eating. Sit on feelings. So in other words, you keep your feelings to yourself. Or express your feelings openly. Many interests or few interests outside work. Now, think about it. If you answer falls on the right side, which will be never late, very competitive, always rush, tries to do many things at once, fast eating, walking, whatever, express your feelings, you hide them, and you have few interests out of work, you are more prone to stress. Don't raise your hand. Just think about it. Are you finding time for yourself to go through that refractory period where you can just relax and enjoy life, or you're always on the move? Now, you may say, well, what does that have to do with mental health? People who are able to take time off for themselves and treat themselves with dignity and respect and can really feel good about who they are less likely to have mental problems than those who do not. So stress, it can be a very dangerous thing if it is not handled well. And sometimes the very simple things that you think about can impact how you feel and how you behave. So that's just a quick little test to give you an idea of how your behavior, the things that you do, can really impact your well-being. The next thing I like to talk about before we get into our questions is something that we do not spend a lot of time talking about, and that is personality. You hear someone say, this person has a nice personality. And the only thing I can think of with a nice personality is the fruit of the Spirit. Think of the fruit of the Spirit. Isn't that a nice person, if you have it? Kind, warm, caring, long-suffering, all those things. Those are the real nice personalities. What about a person who is irritable, easily hurt, always doubtful, feeling inadequate about who they are, shy? And by the way, there's some inheritance with shyness. I'm not saying that shyness is necessarily bad, but I think if you cannot get over the cold feet and interact with each other, with people, that can become debilitating after a while. Suspicious. Everybody is looking at me. Somebody's out to get me. I cannot trust this person. All those little things that we just kind of ignore can really have an impact on our personality. What about this one? Dissatisfied, always chasing rainbows. No matter what you do, you're never satisfied. You have to get to the point where you set realistic goals for yourself and attain those goals. But if you're always reaching out for goals that you can never attain, and that gap widens, it is going to cause problems. And last but not least is over-aggressiveness. Somewhat of a chip on your shoulder. I have to win at any cost. See, that's part of our culture, competition. I got to be number one. I have to be the best. It even goes to the extreme where you become so egocentric. And I don't want to get political, but there's one person who's the most narcissistic person on the planet right now. I'm not calling names. These are the kind of things that will say who you are as a person, okay? So with that, what I did was to set the tone for discussion. We could talk about anxiety, depression, whatever you like to talk about. Risk factors, we can talk about that. Predispositions, we can talk about that. But I want you to start engaging me with some questions about mental health. Okay? Here we go. Who would be first? There's a mic. You had it? No questions? Of course you do.
Hi, good afternoon. So, for those who suffer with anxiety, what environmental factors contribute to anxiety, and how is it overcome, or how do you overcome it?
Okay. That's a very good question. Anxiety can come from many different sources. Now, let me make sure I respond to this question appropriately, because anxiety is normal. And by that I mean the human organism was designed with a certain level of anxiety for survival, so that it prepares you for fight and flight. It also prevents you from taking too many risks. However, if you have anxiety that is different from the norm and it's impacting your ability to interact or engage others, then you have to look at what's causing that. For instance, if you've had a bad experience, a trauma, you're going to always have a level of anxiety because of flashbacks. You're going to also have that in case you find yourself where you have reminders of that incident. For instance, if you were walking down the street in the morning for your early morning walk and somebody's dog rushed out to you, hopefully they didn't bite you, but in case they did, that's even more trauma. Every time you pass by that house, the brain is going to bring back that message to you, and you're going to be anxious. Sometimes anxiety can be due to lack of knowledge. Anxiety can be overcome if you learn how to do what we call cognitive restructuring, changing the way you think. And if you can do that, you will also decrease the fears that you have in your mind. Also, depending on the anxiety you have, if it becomes phobic, where you have a fear of animals or spiders or whatever it is, we can teach you gradually how to get that anxiety out by shaping the behavior and teaching you how to relax. So it depends on the type of anxiety will determine how we treat it. We do have medications for anxiety. That to me is the last resort. If the anxiety is preventing you from doing your regular duties at work or interacting with people, then of course you have to do something to overcome it. Yes, there are anxiety and anti-anxiety medications, but again, very rare do you have to use that unless it's comorbid with other type of problems and really become debilitating, okay?
Fear of flying
Okay.
without taking medications.
Okay, that's a very good question. I had a patient many years ago. How do you overcome anxiety, the fear of flying? The fear of flying. Now, a lot of people really doesn't understand how a plane works. And what I've noticed, when you educate people about the plane and how the plane functions and the safety of the plane, that does release some of the anxiety. However, we have used other techniques of relaxation exercises and in vivo sensitization. And I can describe what I did one of my patients years ago. She had to go to Ireland to visit a grandmother who was dying and she had a fear of flying. This is many years ago. And what I did in the office was, first of all, to educate her about the planes and flying. You know, the most scary thing for people is turbulence. And you know about turbulence? And really, turbulence is a very simple thing. The plane flies with air, and when the air enough air doesn't come through the engine, it drops a little bit. That's all it is. And you call it rough air. But people feel that the plane is crashing because of turbulence. Okay, well, let me finish.
When
Okay.
it's bad weather, it's bad weather,
well,
and
if you
the
have,
plane is shaking.
Okay, bad weather mean again, the plane is not stable because of the environment. However, just about every plane that we fly can drop 10,000 feet and still continue flying. But yes, with bad weather, knowing it's bad weather should relieve some of the anxiety because you know exactly what's happening outside. So always be aware of what's going on, and it does relieve the anxiety. Also, I think that you have to get to the point where you're not going to allow the fear to control your thoughts completely. I know that's a common problem for many people, the fear of flying. As a matter of fact, I've flown so many times in 2 weeks I've been in Africa. Trust me, I've had just about any plane you can think of, including 2 passenger planes, 20 more pounds we can leave the ground. And so I'm telling you, planes are very, very safe. And many times when they crash, it's human error.
Yeah.
Okay? Yes, the planes are very, very safe. So overcoming anxiety for flying has to do with education, and learning ways to relax. learning ways to relax.
Okay. We have a question from an online viewer from Facebook. They ask, how do you know when you have depression, even though depression is overused?
Very good. Depression is not what we call the blues. Depression can be triggered by many different sources. Loss of a loved one, a relationship, a job. Just about anything can cause a person to get depressed. But most people can think about the situation, make sense of what happened, look at cause-effect relationship, and move on. Most people can do that. If the person is unable to let go the situation that caused the depression and is having a lot of thoughts and reminiscing about the incident and unable to let it go, to the point that they're now losing sleep, they're not eating, they're isolating themselves and withdrawing, then the depression is getting to the point where it's controlling their life, and that's when it becomes dangerous.
Okay. Would you consider it hereditary, kind of? It depends on the side of the family or similar incidents in their lives, traumatic, whatever the case may be?
Well, we can only say it is family related if it's a depression that is chemically based. We have two types of depression. One is what you think. In other words, if I want to get depressed right now, all I have to do is start thinking about all the terrible things in my life, and I'm going to get depressed.
Right.
And that's the thought process for depression. You know what I'm talking about,
yes.
okay? But then there are people who have depression. In the human brain, we have what you call neurotransmitters, and one of the neurotransmitters is serotonin. That's the one, serotonin. When that level gets low, it will cause you to feel depressed, which is biological. And you need a reuptake, which is the SSRI, or some sort of medication to get that up. If the person has the type of depression that's biologically based, then medication is always necessary for that. It's very hard to talk yourself out of that because it's a brain thing. But many depression that people have really is what they're thinking. Yeah, life is so terrible, nobody loves me, the place, I'm tired living in this house, my husband is a jerk, death, until that death do us part, I wish it will happen, all these things go on in people's head. So that they get up in the morning and they are negative about life, they're negative about everybody, nothing seems to work, just by thinking.
Yeah.
So we have to separate the thinking process from the biological basis for depression. There's some hand here.
Thank you. I have a question. If someone has the symptoms that you described about not trusting anybody, always afraid, through most of their lives, but they functioned, became a professional person, held a job, retired, and then suddenly all these things magnified, and on medication, but it's difficult because of the levels, function, non-function. Is there hope for that person to recover, even though their mindset has been that way most of their lives?
Okay.
Will medication be able to help them to function or to think logically or anything like that?
Well, again, we have to look at whether or not what the person is doing is really preventing them from functioning. If it's preventing you from functioning, then something needs to be done to change it. But people have had different patterns of behavior in life that they really would not want to change because they're so used to those behaviors. It become part of the repertoire of behavior, and they're not going to just let it go unless there's a major reason for letting that go. There's a saying that old people are grumpy. Have you heard that one? Do you know that that's a false statement? Grumpiness is something that's diagnosed in young people. If you're grumpy as a young person, you're going to be grumpy as an old person. You don't become grumpy when you get old. Okay? So for that person who is having difficulty with trust, we have to find out what happened in their life to make them distrustful. And hopefully we can try to change that generalization that that person has about trusting and try to trust someone, take the risk. You're welcome. Over here.
Yes. Is OCD a mental illness, or is it a good thing to be overly so organized that you annoy everybody else?
Well, to have obsessive compulsive behaviors is not necessarily a mental illness, okay? All of us have some of those, okay? I don't know how many of you maybe check the door a couple of times before you leave, or you check the stove a couple of times before you leave the house. It doesn't mean that you're OCD. It depends on if it is causing you to become debilitating, where it's impacting your interaction with others and how you feel about yourself. Then it becomes a problem. So it depends on the level of obsession you have, not the fact that you have those traits. All of us have those.
What is your advice, or what's your take on individuals who have been diagnosed with some form of ADHD, and any advice you could give on how to help direct that person and how to just be productive in life?
Okay. You know, this is interesting. When I went to school many, many years ago, ADHD was not an issue at all. And I'm not saying that it's not a legitimate diagnosis, don't get me wrong. I think it's a legitimate diagnosis. But I think that it is off the chart right now because people use it as a way of describing who they are as a person. The reason I'm saying that, most of the years we study this behavior, we look at it as a childhood disorder. And the reason we look at it as a childhood disorder is because the child doesn't have emotional regulation in place. And as you get older, you learn how to control your emotions and your behavior. So as an adult, hopefully, you'll be able to regulate things differently, and you know when you need to slow down and so on. However, over the years, we have come to the conclusion that the same behaviors are in adults. I think with anyone with attention deficit disorder, we have to have much more rigid control of how they do their time management, how they set goals for themselves, and be much more organized in order to function. Yes, we have medications that work with that. I'm not a big medication person, but sometimes it's needed, depending on how it's impacting the person. For instance, children who cannot function in school because of their attention, sometimes Adderall, Ritalin, Concerta, those type of medications, they do function better, even though those are stimulants. So it's kind of hard to describe that diagnosis. But usually, if the person can really set realistic goals, somebody keeping tabs on them if there's a relationship, it can really help control the impulsivity that you find with ADHD most of the time.
I have a follow-up question. As far as holistic or pharmaceutical ways of treating illnesses outside of schizophrenia and bipolar disorder, in your best advice, like which one would be more suitable to healing someone? Holistic view or pharmaceuticals?
It depends on, again, the severity of the problem the person's having. I'm a strong believer that God made the human organism to really treat themselves, in the sense that if you follow the basic principles of living the Christian life, you'll be surprised how well the human body works. Yes, there are herbal medicines that work. For instance, people who are depressed have used St. John's wort, which is a herbal medicine. We found out that it's an SSRI, it's a serotonin reuptake, even though it's a herb. So some things work in terms of herbal medicine, but a big part of this is lifestyle. You know, if you eat well, you exercise well, you sleep well, you're already halfway there in taking care of any problem you have. Those three things. So yes, there are things you can do to handle just about any type of mental problems that you're having, apart from the ones that require medication. Yes. Okay. No. Yeah, you need a mic.
Sorry.
Okay, go ahead.
I personally believe there could be a place for both. The natural method is preferable for me too, especially as a preventative measure. But then also, you know, when you need surgery or different things like that, these pharmaceutical components could become important. But as far as in that topic, like, what is your take on marijuana? Because I know individuals who are diagnosed with ADHD or other different mental things they struggle with, or pain, emotional imbalances, and for them, they claim that that is something that has been helpful. I'm wondering, what is your take on that, or do you think that it has a place?
This is really interesting. A few hours ago, I was reading some recent literature on marijuana, because that's a topic I'm going to be talking about in Africa in a week or so. And THC is your culprit here. And THC actually works just like any other drug of addiction. Cocaine, heroin, and those. We know that it does increase appetite. We know that it does help control certain symptoms of glaucoma and so on and so on. And again, we haven't got any major scientific evidence for those, because to get to that point, you have to do a lot of studies and trials and so on. So I've seen some literature saying that it's okay for certain type of medical condition, but also I've seen research, not primarily in the United States, but in England and other places, showing that marijuana has some serious medical precursors and risk factors. A lot of chromosome aberration, a lot of problems with dysfunction in men sexually, and many different types of things that we don't talk about. So it depends on how long you use it and for what reason you use it.
Thank you.
Hello. Okay, you sort of answered a part of my question based on what this couple asked. Can you give me the explanation between schizophrenia and bipolar disorder? Because I seem to be running into a lot of people who has bipolar disorder, and I kind of don't know the difference. But you kind of answered what impact medication had on that. So if you could just define the two, please. Thank you.
Well, bipolar disorder is the new term for manic depression. That's the old term we used to use. What that means, the person have very high highs of elation, of impulse control and activity, and this person would be going out and spending money, buying things and buying t-shirts to make $1 million, a lot of irrational type of beliefs associated with a high. And then they get depressed to the point where they're debilitating, cannot function. So the bipolar is high and low. That's the manic depression that we're talking about. The medication that we use for that are mood stabilizers, which will control the highs and the low. Schizophrenia is a disorder of the thought process where there's a loss of reality. There's a loss of reality. The person is having hallucinations, delusions, and those kind of things some of them are fixed. The delusions can be fixed. I've had patients who thought that they were Moses, God, the president, and you cannot talk them out of those delusions because that's what the mind is telling them. So those are the ones who will need psychotropics to work with them. For bipolar, you can have a comorbid situation, but for just plain bipolar, we can control that and the person can function normally with the mood stabilizer. I've had law students who are bipolar and they're lawyers right now on Wall Street, so I know that they do well.
Dr. Campbell, hi. As believers, when do you determine, professionally, when somebody is just crazy or they're possessed by a demon? It's a serious question.
No, I understand. Okay. Individuals with what I call persistent mental illness, and I'm talking about a serious mental illness, and the term crazy, I guess, means someone who has lost their mind. Okay? That does not happen overnight. You can see some behaviors very early in the person's life, and usually it becomes full-blown in late adolescent and young adult. That person, we can trace their behavior and know developmentally if they have a major mental illness. In other words, a person can have what you call a psychotic break or a substance-induced psychosis. By the way, marijuana can do that too, where you just lose your mind, okay? That usually is temporary. But the person who is evil, I think, is the person who have had no interest in following the laws of society. There's a component of conduct disorder. There is a belief that they have to make a statement to others and be famous, and many other types of behaviors that are not considered within our values and our belief. This person really is obsessed with evil. They do not forgive, they have vengeance, they want to hurt others, and it's something that they believe that they have to carry through in order to fulfill that need. We have had situations where I've had ministers that I've met who actually had to do exorcism. And people think that the Exorcist movie is just a movie, but there have been exorcisms that Adventist pastors have done in Guyana and other places. So we know that a person can be possessed with an evil spirit. So those are the two ways of looking at it. Developmentally, you can see the problem compared to someone who is just evil and want to hurt others. Yes?
Is there a correlation between cortisol level and serotonin?
I am not sure, but I know that the serotonin levels that we have in our system can be impacted by cortisol level and other types of chemicals in the body. There are certain foods, for instance, can also cause a person to have a low serotonin level. But most of us function well just by the way we eat and live, and our serotonin level will remain. But once you start getting depression that become debilitating, that's the first thing we look at, your serotonin level. Yes. What our sisters say, that if your body lacks certain types of minerals and so on, for instance, vitamin E is one that she talked about, that can cause your serotonin level to go down as well. Okay. Question?
Okay, that would be the final question.
Final question.
Stand up. Yes, just like you said, when we were growing up, there weren't so many ADHD children. I've been noticing a lot of autism now, and I'm wondering whether there's a correlation. There was a lady that came to church last Sabbath, and she had a girl that seems to be about 2 years old, and I was sitting her toward the middle. She said, "No, let me sit in the back," because she breaks out screaming. So after fellowship, after service, we were fellowshipping, and I realized, she told me, "Well, I have a 5-year-old at home. He has autism." Mm-hmm. And then I'm looking at the 2-year-old, and she just gave me a very blank stare. Mm-hmm. And I'm wondering, is this something that if caught early could be treated, and what's causing all this autism lately?
We are really concerned with the increase in autism in children in the United States. It's higher than any other country in terms of the rate of autism. And we really don't know what is the reason or the cause of autism. However, the earlier you can diagnose the child, the better outcome you're going to have, because we do have special programs that will help kids who are autistic to develop language and other type of skills that if they do not start early, they will not acquire it. So yes, it's important if a parent has a child who is not going through the developmental milestones very early, simple things like creeping, walking, toilet training, and so on, and language acquisition is the number one. If there's one thing that you can use as a diagnosis for autism, is language acquisition. They do not have the ability to talk. So the earlier you intervene, the better outcome you're going to have. Okay. Well, thank you very much.
Thank you so much, Dr. Campbell. Let's give Dr. Campbell another round of applause. So well done. All right, so next week, come back. We're going to have Dr. Smarts here, and we're going to be talking about mood disorder, talking about depression. And what we're going to do, we're going to change the format a little bit. We'll put a basket in the back, and you could write your questions down so that we can get many more questions answered, right? So make sure you're back next week. Sister Cassandra is going to be here also and talk about the village to fight depression. So you can't afford not to be here next week, okay? We have even more for you for the following week. All right, so in keeping with the format, we're going to form a circle, and we're going to have 2 prayers to close. Oh, pray the closing prayer. Okay. All right, let's stand and have closing prayer. Almighty Father and our God, we're just so grateful, dear Father, for taking us here today, dear Father. Dear God, we're touching on some sensitive topics and sensitive areas, dear Father. But dear God, we're thankful that you brought Dr. Campbell here to clear up some of these for us, dear Father. Dear God, we ask that you'll just continue to bless us. Bless this church, bless our family, dear Father, and just keep us together in your love and in your care, dear Father. As we're in the middle of the week, dear Father, and we know we still have, more battles to fight, dear Father, but we ask, dear God, that you'll just continue to strengthen us, dear Father, and just lift us up. Take us home safely, dear Father, and continue to bless us and keep us in your care. We pray in Jesus' name. Amen. All right, so we're just going to form a circle. I know we've got just areas that we just keeping in line with our usual thing, and then.